episode number 272 of the Wholesome Fertility Podcast. My guest today is Allison Locke. Allison is a fellow traditional Chinese medicine practitioner and also an integrative health practitioner based out of Vancouver, British Columbia. She is a fellow of the American Acupuncture and TCM Board of Reproductive Medicine, ABORM, and a member of the Obstetrical Acupuncture Association, OBAA. With additional training in fertility and reproductive health, as well as her personal experience with stage 3 endometriosis, Alison is particularly passionate about treating endometriosis and chronic pelvic pain. Welcome to the Wholesome Fertility Podcast. I'm Michelle, a fertility acupuncturist, here to provide you with resources on how to create a wholesome approach to your fertility journey. Welcome to the podcast, Allison.
Thank you so much for having me. I'm so excited to be here.
Well, I'm so excited to have you on, and I thoroughly enjoy your Instagram, by the way.
Oh, thank
so
you.
You guys got to check out her Instagram. I have it in the episode notes. You have so much great information.
Oh, thank you.
You're really knowledgeable about your topic.
Yeah, I love doing I love the social media part. I love educating. I love trying to have like a fun, humorous spin on it too. So I have fun with my social media.
Awesome. So for the listeners, I would love it if you can give us a bit about your background and how your own personal journey really got you to the work that you're doing.
Sure. So I'm an acupuncturist and integrative health practitioner based out of Vancouver, BC. And I have special interest in kind of fertility, reproductive health, hormone health, menstrual cycle stuff. I was kind of thrown into that field of work upon graduating school. And that's kind of when I fell in love with it, when I started learning more about the menstrual cycle and hormones and fertility. And I realized how much there is to know and how many people who menstruate don't know about their hormones and fertility. And so I thought it was such an important aspect of health to educate more on. And it wasn't until a few years into my practice that I was actually diagnosed with my own kind of hormone issues as well. So that's when I was diagnosed with endometriosis, which is a really common gynecological condition. And ever since then, I've just been obsessed with learning everything I can about endometriosis and hormones and trying to help people that are kind of in the same shoes that I am.
Yeah. So tell
Yeah,
us, well,
100%.
how did you actually get into it? Did you work for somebody who specialized in fertility when you got out of school?
Yeah, so the clinic that I wanted to work at, that I was kind of interning at and transitioning into, that was their kind of their bread and butter. So they did a lot of fertility and women's health. And so upon graduating and starting to work there, it was just kind of part of my education of like all my extended learning and mentorships and stuff were under people that specialized in fertility. So I had this like really great knowledge base and experience right off the bat, which was really crucial for specializing in this. And it was, yeah, it really, really helped a lot.
That's awesome. And so I know that we hear a lot of common myths. I mean, one of the things I think that was eye-opening for me is like menstrual cycle, like PMS, and all of the things that we have are actually not normal, even though they're common. You don't realize this
Mm-hmm.
until you learn what you learn. And that's when you're like, oh my God, this is actually not normal. And it's an
Yeah.
imbalance. And we can work on that. Like it almost feels like we just accept it as reality. So I'd love it if you could talk about some of the
Mm.
common myths that you see and like let's bust them.
Yeah, I feel like that's a really huge one, that like PMS and period pain is normal. And like to an extent, like a little bit of PMS, like a little bit of menstrual discomfort to an extent can be normal. I mean, your body's doing, a very physical thing. But if there's like really severe PMS that's really disrupting your quality of life, if there's really painful cramps that's impacting your ability to go out with your friends or work or any of that, that's absolutely a sign that something is wrong, that there's a hormonal issue, there's inflammation, there's something else going on that we need to look further. And you're right, we are just kind of like programmed as women as like, this is just how it is. We just, suck it up and get on with our day. And that's just kind of how I feel like a lot of us, especially my generation, we were just kind of programmed to do that this is just a part of being a woman and this is a normal part of being a woman. But in fact, our period and is kind of like our monthly report card of how everything in our body is doing. And it's such a great visual of like, okay, these are my PMS symptoms, and this is kind of what it's telling me. And then this is how my period is, and this is what it looks like, and this is what it feels like. And that's also telling you so much information about your hormones. And I think that's kind of what I really love about Chinese medicine too, because even if things are like, normal according to Western medicine, like I have a lot of patients with really bad cramps that go to their doctor and they're like, well, everything in your blood work is normal, your ultrasound's normal, but they're still having like debilitating pain. And that's when I think like Chinese medicine is really powerful because we'll obviously see like, oh, you've got tons of liver qi stagnation or blood stasis, or I'm seeing so many symptoms of cold in the uterus. And it's almost like really, it's just really empowering, I feel like, for the patient too, where it's like, no, we don't see everything like checked off as normal, even though your blood work and ultrasound is okay. I mean, that's really great too. But for Chinese medicine, we're always looking at this deeper underlying pattern and all these subtleties. And it's kind of painting this picture of the imbalance within the person.
Yeah, totally. It was really eye-opening for me because I had one patient with severe PMS to the point where she's like, I have to avoid people because I'm just not like a kind person around that time. And she was actually a friend of mine. And I was like, you know what? I'll help you.
Mm.
No problem. And so she started coming in. And one time she wasn't trying to get pregnant. And she was like, she thought she was going to be late because she was like, I'm not getting any of my symptoms and I'm supposed to get them right around this time. Something's off. And then all of a sudden she just gets her period. She goes, what? She's like, I just got my period. And I'm like, exactly. I'm like,
I
your
love that.
liver chi is flowing really freely right now. That's why.
Yeah. That's like the magic of Chinese medicine,
Totally.
the
It's like
surprise
the total
period.
flow. Yes, exactly. It's like
Yeah.
the flow. But it's
Yeah, your
funny, people
period
don't
should
realize
kind of
that.
sneak up a little bit on you. Yeah.
Yeah. I mean, you do feel, you definitely like feel your body's cues, and the same thing with ovulation. When you get really in tune with your body, it is
Mm.
important to be able to like pick up on the details, but it shouldn't be so severe to the point where you can't, like you said, you can't deal with normal life events.
Mhm. Yeah, definitely.
So, what are some of the most common things that you see when it comes to the menstrual cycle
Mhm.
irregularities regarding fertility?
Yeah, so there's a lot of different patterns, and that's kind of the really fun part about Chinese medicine is that we're kind of like little detectives and we're like piecing together every symptom and kind of painting this picture of what's going on internally with the patient. So, I mean, like each organ system has its own characteristics and they all kind of play a role in fertility and overall health because we don't really think of in Chinese medicine as, oh, the reproductive organs are just their own specific thing. It's kind of the whole
Right.
body has a play in it. So like what you're talking about, the liver chi. The liver chi is so tied to menstrual health. I am working with liver chi day in and day out when I'm working with
Yeah.
fertility and endometriosis and hormone health. So the liver chi is like really, really important to make sure that everything's moving smoothly in the body, and that's emotionally and physically. And then like the spleen chi and stomach chi and the digestive system is also really important because you want to make sure that your body is able to get all the nutrients that it needs and there's not a lot of inflammation there. We want to make sure the blood is moving really smoothly, like blood stagnation, chi stagnation, digestive deficiencies. I see that a lot. And then the kidney organ system is also really tied to fertility in Chinese medicine because it's kind of like it gives you that kind of DNA deep level energy to the egg cells and the sperm cells. And so making sure that those are really healthy because a lot of poor lifestyle or genetics can impact the kidney energy system. So we always want to kind of help support the kidney energy with fertility.
Yeah, for sure. What I find really interesting and hopeful about really how Chinese medicine talks about the kidneys and talks about like the essence is that there's like pre-heaven and post-heaven. And so yes, pre-heaven we can't really
Hmm.
do much about because that's pretty much what comes from our parents. But post-heaven is really
Yeah.
how we choose to live our life. And we've seen that we can actually reverse age, like biological age, through the choices that we make. And I
Hmm.
find that to be great. It's very empowering to know that your choices can make a difference on your body.
Absolutely, yeah, and I think that kinda goes back to where I really feel like Chinese medicine is such an empowering medicine because there's so much that you can do, diet, lifestyle, herbs, supplements, acupuncture, all those things really can have such a huge positive impact, and it's kind of like, yeah, I love the pre-heaven and post-heaven. We are kind of given what we're got with, like, our
Yeah.
basic genetic blueprint, but our post-heaven essence is like epigenetics, where we have the
Uh-huh.
huge percentage of, influence over our health, no matter what our genes are saying. And we have so much influence over that part of it. And I think Chinese medicine plays a huge role in that.
And do you find that there's a correlation? Because I mean, listen, we're living in a very toxic life. Like the environment, everything's just like around us, and the foods that we eat, the extra ingredients that they put in. It's the reality is that you really have to be careful on what you expose yourself to, what kind of cosmetics, and the endocrine disruptors. I feel like that really bogs down the liver and it weakens its
Mhm.
ability to do its job. And then sometimes I'll see things like fibroids or certain things kind of popping up because the body's not able to like really clear up the toxins. And sometimes I'll find that the person is working in an environment
Mhm.
that has more toxins than normal. And so we have to kind of work extra, a little extra to release that or clear that out. And even for IVF, I like to do that as well. Right after a retrieval, do some kind of
Mhm.
like very mild, nothing too harsh, but like mild liver detox to just help the body release the excess
Yeah.
hormones, because I really feel like that aspect of it can really impact the way the reproductive health expresses itself.
Yeah, I completely agree. I think there's a lot of things in our world right now that are impacting our liver, and we are, as Chinese medicine practitioners, seeing that reflected a lot in liver qi stagnation. And I think that's why there's so much PMS and period pain and infertility kind of that's pretty rampant because we are seeing, like, I don't think I have a single patient where their liver didn't need like a little bit of support in the Western sense and in the Chinese medicine sense. So yeah, I do love that you do pay attention to that, and especially like post IVF or something when all those medications it's really working the liver. And not that those are bad medications at all, because they're really useful and they're doing really wonderful things for patients to help reach their goals. But yeah, you're right. I do think there is a place where we can kind of help support the liver, especially post IVF.
Yeah, for sure. So as far as endometriosis, I know that like gut health is really, really, really
Hmm.
important when it comes to endometriosis. So the inflammation, how that impacts leaky gut. So what are some of the correlations or like the patterns, not necessarily just with Chinese medicine, and you could talk about that as well, but like
Hmm.
just some of the links that you've noticed or the things that tend to go hand in hand with endometriosis.
Yeah, that's a really good question. I love that you asked that because endometriosis is such a full body disease. Like, it's not just something that's happening in the pelvis. So, yeah, the gut connection is huge. I find that to be honestly, like, one of the biggest roots of something that we need to focus on and kind of, like, rectify with a lot of my patients with endometriosis, because the gut is such a foundational pillar of health, and so if there's anything going on there with, like, leaky gut or microbiome, or there's subclinical gut infections, or SIBO or whatever's going on, then we really need to work on kind of correcting the dysbiosis, because not only does that create a lot of inflammation, but there's also such a huge microbiome and bacterial component to endometriosis. Like, there's so much research coming out about how people with endometriosis have different vaginal and uterine microbiomes, and all of our
Mhm.
microbiomes in our body are connected. So I really do feel like if we focus a lot on gut health and working on any kind of issues that are super apparent there, then it makes such a huge difference in like overall inflammatory levels, which are totally going to help with a lot of the endo symptoms and the endo pain. But
Mhm.
also kind of helping with the microbiome component is really important for fertility, because we do know a good vaginal and uterine microbiome is super important for fertility, but I also find it really helpful for endo symptoms. And then I also love looking at the nervous system, because I find that if we're kind of like if we've got some like circadian rhythm dysfunction because we're not sleeping well or we don't have good
Mhm.
sleep hygiene, or if we're
Mhm.
just kind of continuously operating out of fight or flight mode and we're just never in parasympathetic mode, that's going to totally cause a lot of inflammation in the body. And that's going to absolutely affect your endometriosis. So, those are two things that I find a lot of people with endo can benefit from working on. And that's, yeah, correcting any gut dysbiosis and really working on gut health. And then also really working with the nervous system. Like, we really need to work on this chronic stress epidemic and like having a good
Yeah.
circadian rhythm. I've been doing a lot of I've been like looking a lot into like the cortisol awakening response lately. I've been really nerding out
Mhm.
about it and how
Mhm.
it's how your cortisol levels like really need to have that initial spike in the morning, and
Mhm.
not only for you to like feel good and get out of bed, but also it's a really important indicator of like inflammatory levels in your body. And there's also a really important autoimmune component, and we do know that endometriosis has this kind of autoimmune overlap with it. And
Yeah.
so any of my patients that I'm hearing like, oh, how do you feel like when you get out of bed? Like, how long does it take you to kind of feel alive in the morning once you get out of bed? If it's like, oh, 2 hours and 5 cups of coffee, I definitely know that
Yeah.
there's some cortisol awakening response that we need to kind of work on in order to like really help with the immune and inflammatory stuff. So yeah, those are a couple things that I'm always looking at for my endo patients.
That's really great information. Vaginal microbiome, I think, is huge because I actually was at Megaspore
Hmm.
Bioticon, the microbiome labs. They had a little conference, and I listened to a lecture by Dr. Jolene Brighton, and she was talking about the vaginal microbiome and
Oh,
how
I love
important it
her.
is. She's amazing. She always has great information. She just always delivers.
Yeah.
And so she talked about that, and she said
Hmm.
that in
Absolutely.
Spain, they'll always check the vaginal microbiome, and especially when people are doing IVF and transfers specifically. And I had
Oh.
one of my patients going to Spain. A lot of people go to Spain. I mean, they save money. The only thing is they lose money with the flights and everything, but they're really
Uh-huh.
good doctors, and like the clinics are great. And so what they do is they
Oh, that's good
actually
to
have them
know.
almost like always on a protocol to check their vaginal microbiome. They always check it before transfers. And they
Mhm.
have these women going on vaginal suppositories for the microbiome to support it. And I had
Yes.
a recent patient who is like advanced maternal age and she's pregnant, but she was on the suppositories. They were checking and making sure because they said that she was mentioning that there's a link between, I guess, imbalanced vaginal microbiome is a little different in the sense that it's like you don't want diversity. You want it to be more like a specific type of
Mm.
strain. She was saying that there's a connection between a poor balance of the vaginal microbiome and recurrent miscarriages, unexplained infertility, and failed transfers. And
Mhm.
that's huge. That's so important. And nobody really checks here, like
Yes.
in our world, North America.
Yeah. Well, actually, in Vancouver, where I am, there's one clinic that does for some patients,
That's good to
and
know.
I have like the past year or so, I've been having a lot more patients do some microbiome testing. They'll do the swab. It's called the Emma Alice, I think that they do here, in a couple of the clinics, and they'll do the probiotic suppositories. And I honestly like tell my patients to go get them too, and direct
Yeah,
them where they can find them because I think it's always a benefit. Like, it's such a harmless intervention. It can only help. Like,
totally. It's
and
an
they're
expensive
so easy
test
to do.
either.
It's so affordable. Yeah,
Yeah,
exactly. Yeah, and it does improve transfer results and pregnancy rates and everything. And so, yeah, I'm a huge fan of
no
doing like
brainer.
microbiome testing for fertility. Yeah,
Yeah,
right?
it's a no-brainer, and I think that it's so important, and I'm so glad you brought it up. And I'm glad to know that some places are doing it. Places I haven't seen it yet. I haven't seen that to be like really commonplace, and I've been actually
Oh
running
yeah.
it for some of my patients. But I'm glad to
Oh,
hear that some
nice.
people are starting to do that. That's great. And then as far as nervous system and circadian rhythm, that's huge because it's kind of like I always look at it almost as like the
Mm.
second hand is going to impact the hour hand. So like the second hand could be like our 24-hour cycle
Mm,
versus our 30-day cycle or infradian rhythm. So the circadian rhythm impacts the infradian
yeah.
rhythm. So it's important to have a good circadian rhythm. Interestingly, if I look back, I also have a history of we all started as patients, I think a lot of us. So I have a history of
Yeah, right?
irregular periods. And what I did
Mhm.
was I used to have the worst circadian rhythm. I used to not be able to wake up in the mornings. Like I would,
Ah,
if left to my own devices, I would stay up until like I would sleep until 2 p.m. some days when I was like younger in my 20s, and then I'd stay up
right,
till 2, 3, 4 sometimes. I mean, I was just completely off, and I don't know. I always blamed it on college or whatever, but it was just definitely my rhythm. It was just
right.
the way my body was. And now I'm much more regular just over time, and it kind of synchronized with like my menstrual cycle. So, is that something that you see often?
Mhm. Oh, absolutely. Yeah, and it always kind of goes back to like Chinese medicine roots of like we need to sync with nature. Like when the sun's down, that's our yin time. That's not the time to do a lot of work or exercise. That's a time that we're supposed to be slowing down. We're supposed to be asleep. Like I'm always coaching my patients like I want you in bed by 10 p.m., 11 p.m. at the latest. I do not care if like you're
Yeah,
naturally a night owl. Like that is
right.
the kind of ideal Chinese medicine bedtime because we
Yeah,
really do get those better hours of sleep in the earlier hours of the night. We get that deep, restful sleep, and it really does make a
true.
huge difference. I've been, yeah,
Oh,
personally, like really
totally.
prioritizing regular sleep cycle the past couple years, and it's been like revolutionary for how I feel, like mood and energy, but also my endo symptoms, and I have an autoimmune disease, and so it's been really helpful for that. So I think it's really easy to overlook the basics of like, well, I'm getting my 8 hours, even if I'm going to bed at 2 a.m. Or, sleep, I'm getting enough. I'm getting about 6, 7 hours. That should be enough. But it's
Right.
like really irregular times. Like your body can't really cope with that. And I think it's really important that we go back to these like super basic principles of like, are you sleeping on time? Are you eating at regular intervals? Are you doing regular movement? Like these really basic things, these small habits really add up to make such a huge difference in health problems. And especially even like super complex chronic health problems, it can be really revolutionary.
Oh, yeah. And there's definitely studies that have been linked to irregular periods and also infertility when it comes to having night shifts. So, like
Hmm.
night shift hours, it really impacts the reproductive health. So, it's really
Yeah.
fascinating because it's not just the hours, it's really it's the when, not just the amount.
Hmm.
So I studied Ayurvedic medicine. That was also very eye-opening when it comes to like really understanding the rhythms of nature
Oh,
and how
cool.
our bodies synchronize and also the elements of food and really understanding like how our bodies do better. It's almost like really understanding the time cycle of the day and optimizing it. And when it comes to intermittent fasting, fasting itself is actually really, it could be very beneficial if done right. And I want to say that like really, really in strong words, if done right, because I personally, from what I understood and how much I've learned as far as the sun goes, like the sun helps our agni, which is our
Hmm.
digestive fire. So the best
Mm,
time to eat really is during the
right.
day. So breakfast, lunch, lunch should be the largest meal of the day, and that's when you should have those difficult to digest proteins and have that like during that time because at that time the sun is at its highest where the day is the most young it could be. And so you want that young energy, that fire to be supported by nature's rhythms to help your own digestive fire. And then what you could do if you want to fast is fast at night versus in the morning. And that's what a lot of people do. They'll fast in the morning.
Right.
And it's been shown that it could possibly not be great for women because it's been mostly studied on men and they have a
Hmm.
completely different rhythm. So
Yep.
that's something that I always suggest if you really
Yep.
do feel that you need to fast for a little bit and have like a little break digestive wise, it's better to do it
Hmm.
when the sun goes down.
Yeah, I completely agree. And I do feel the same about fasting. Like to an extent, I like fasting, like, a good maybe 12, 13 hours, maybe 14 hours for some metabolically flexible people. But I've always been a huge component of breakfast just because in Chinese medicine, like the stomach channel time is in that morning. And that's kind of always when historically they say that's a great time to eat. And I feel like, yeah, this huge intermittent fasting kind of craze can be good to an extent and when utilized properly, but I'm
Correct.
always going to go back to like, what have we been doing for 2000 years that has been working
Yeah.
really well? Like, I think there's a lot of parts to Chinese medicine where, yeah, a lot of the health trends and health fads are just not going to resonate. And that's kind of always my good reminder of like, okay, well, let's go back to what nature and what has been working for humans for, thousands of years.
No, totally. And then also think about like the light, because like light hygiene, as you want to call it, you want to get
Hmm.
exposure to light early in the morning so that your body knows, because that's how our bodies respond.
Right.
Our bodies really respond to light. So
Yeah.
I always prescribe this. So like go early in the morning, get some sunlight while it's safe, early. And
Hmm.
then, of course, obviously protect your skin if you're skin sensitive, and
Yeah.
especially later on. But like early in the morning, it's easier for your body to process. I almost kind of compare this in my mind as like a hose
Hmm.
of water. So you want water when it's trickling, it's much easier to drink. And then, like in the middle of the day when it's like shooting out, you're
Mm,
going to choke. It's too much. So it's better
right.
to have it early in the
Right.
morning. We're able to really get the vitamins. And I remember my grandmother
Yeah.
always telling me, early morning sun will give you the most vitamins. That's how she explained it, the most nutrients. And she was right.
Ooh, I
She was
love
right.
that.
She said that. She's like, early morning sun,
Yeah.
that's what you want. And so, and not only that, it also anchors the circadian rhythm, and then also getting moonlight. So, like, not having the fake light,
Mm,
dimming the light at night. And that could
yeah.
really, so that's why I would say, like, light hygiene is to kind of dim it at night so that
Right.
we go back to our roots. And this is just, it's what nature has intended for us.
Yeah. Yeah. I completely agree. All of that. I mean, it's always a good reminder to go back to nature of like the super basics. When it's dark, like it should be dark. It should be quiet. It should be
Right.
in. It should be asleep. And
Yep.
then, yeah, during the daytime, that's when things are active, including our digestive system. Like it seems, yeah, nature was designed for it to be pretty clear to us, like what we're supposed to be doing.
Yeah, for sure. And so what are your thoughts about taking melatonin supplements?
I think it can be helpful. I mean, I am not a huge in high dose melatonin. So I'm more of like the 1 to 3 milligrams because that's kind of akin to what is naturally produced in the body. There's some research that shows that a high dose can be good for endometriosis, like even up to 10
Hmm.
milligrams because of its antioxidant effect. But
Hmm.
I've only had it be helpful for a small group of patients, like not a lot. So it's not my favorite one to go to because I don't think that it's going to be hugely beneficial for the circadian rhythm, but I do find it helpful for some patients, and I love it as like a general antioxidant if your levels are
Hmm.
kind of low because we have so much light in the nighttime and stuff, so our bodies are naturally kind of a bit melatonin deficient. If you're taking a decent dosage of like 1 to 3 milligrams and it's really helping you sleep and you're noticing a huge difference, awesome. But I
Yeah.
also see a lot of patients where it doesn't do a lot for them or it makes them feel groggy. And so I think it's a
Yeah.
really case by case dependent. Like if it works for you and you're on a good dosage, awesome. If it's not, like I'm
Yeah.
not too hard pressed. Like there's a lot of other alternatives. I love a lot of adaptogens and stuff too that can kind of help reset their circadian rhythm too. So yeah, it's not my absolute favorite go to, but there is like some really good research with it for fertility and egg quality because of its antioxidant effect. So I don't hate it.
Yeah. Well, the great thing is that getting that early morning sunlight induces cellular melatonin. So it actually brings that out of you. So it is a
Yeah,
great way to get that
that is
is through
true.
natural light, but also through light
Mhm.
therapy. So light therapy can help that as well. So is there anything else that you're like passionate about, excited about, that you're like learning about recently that you're finding is really helpful for your patients?
Besides the cortisol awakening response, which I've been really nerding out about, and just like cortisol in general, I find is such an underrated hormone. And people are either like, oh, we want to squash it or we want to raise it, but that's like so much more complex and intricate than that. So I've been really kind of diving into that and like some more Dutch test stuff. I find I'm always just learning. I love learning so much about estrogen metabolism and methylation because I
Hmm.
find that a lot of patients who are struggling with reproductive health stuff and fertility and especially endo and stuff, a lot of them we're just not metabolizing and methylating estrogen correctly. And so that's
Hmm.
causing a lot of symptoms. And so I've been really kind of doing a lot of research into that, which I've been finding so interesting. So yeah, I feel like that's kind of, yeah, liver cortisol,
It's
all
all
that kind of
liver
stuff is
stuff,
where my
liver
head
stuff
has been
again.
lately.
So what have
Yes.
you
Always
seen
back to the
is
liver.
effective? Yes. What have you seen is effective for estrogen metabolism?
Yeah, well, it depends like at which phase people are having the issues. If it's like the metabolizing into the 4-OH, 16-OH, 2-OH, or if it's like the actual methylation process, because there's different, supplements and herbs that I'll recommend. So that's where I really love testing, so we can really like see exactly where the issue is, or if it's in phase 3 estrogen metabolism, where we really need to focus on the gut health again,
Mhm.
because there's too much beta glucuronidase that's recirculating estrogen levels and stuff. And so there's different things that we can do for that. But yeah, I just love like the basic things that your liver needs is like magnesium, B vitamins, enough protein, enough iron. Like there's some really basic stuff that I think if we're just really focusing on through like healthy nutrition and stuff, then a lot of that stuff can be helped. So honestly, we don't even need like crazy amounts of supplements and herbs if there's these issues going on. Sometimes your body just needs like really basic levels of magnesium and B vitamins and hydration and
Yeah.
acids and stuff, and then all these things can kind of work efficiently.
Yeah, sometimes I find just warm water and lemon on an empty stomach every day because lemon is like the sour taste
Yeah,
for the liver.
yeah,
Just
that's a good
something like
one.
that. It's such a simple, it's so simple. It's
Hmm.
almost too simple that people think it's like, how could this work? It's too simple. But it's
Yeah,
amazing. But that I find really good.
yeah, that's kind of how I feel about like castor oil packs too.
Yeah. Oh, yeah. So talk about those because that's actually really effective, I find, and moving like the lymph and moving that stagnation.
Yeah, absolutely. Yeah, I'm a huge fan of castor oil packs, especially like after my patients have endo surgery where they have laparoscopic abdominal surgery to remove the endo lesions. I love using castor oil packs post-operatively to help like reduce scar tissue formation and to really help with the healing process and the blood circulation and lymphatic movement and everything. So castor oil packs are basically you apply castor oil to the abdomen or liver and then you place a heat pack on it and you kind of just relax with the heat as the oil kind of seeps into your skin and does all the magic that it needs to. And it is such like a simple intervention, just like warm lemon water in the morning that I find is just such an easy thing to do. It's really cost effective. It's really relaxing. Like it doesn't take a lot of effort. You can do it like while you're watching TV. Like it's a really easy thing to kind of incorporate into your life. But I do find it really really helpful for like reducing period cramps, helping people to recover post abdominal surgery, for liver detoxification. Like done
Yeah.
regularly, it can have a lot of really positive impact.
For sure. And what are your thoughts on when to do it on the menstrual cycle? Because I do hear like conflicting perspectives on when you should
Mhm.
do it. And then you could also move it at certain times to the liver rather than the abdomen.
Yeah, that's true. Yeah, so I'll never recommend it during menstruation or like at least during your heavy days because I do think it can cause a little bit too much blood circulation and that just might increase the bleeding. And then I'll
Mhm.
never recommend it after ovulation if you're trying to conceive. So if there's any chance
Yeah.
of pregnancy, we kind of just want to like take care of that like precious area. We don't want to do anything too moving or detoxing. Like that's even like a point in the menstrual cycle where I won't do too many abdominal points. Like I kind of just like let your body do what it needs to do. Like it knows how to do it. I'll do a lot more distal stuff to kind of help with blood circulation and hormone balance and whatever we're working on. But yeah, anytime that there's any chance of pregnancy, I like to leave the lower belly alone.
No, it's true. I do the same thing actually. I do like right after ovulation, I tell them not to do it. And they're like, and it pretty much minimizes the
Hmm.
window to like after period,
Yeah.
in between that point. But I usually like to be a little more conservative on that as well, unless you're trying to prepare your
Yeah.
body ahead of
Yeah.
time.
I'm definitely err on the cautious side.
Yeah, me too.
Yeah,
You might as
true.
well. Yeah, totally. So this is
Yeah.
great conversation. I'm sure we can keep talking about all kinds of topics and questions. And so if people want to work with you, so you do Dutch testing, you do some testing, and you do some online work.
Hmm. Yeah, so I'm CFG Healing on all the social medias and my website. I'm seeing patients in person in Vancouver and Burnaby, British Columbia. And then I do see a small amount of patients virtually. So if you're elsewhere and want to work with me, we can do some telehealth.
Fantastic. Well, Allison, it was awesome speaking to you, and Thank you so much for your insight and information. And guys, I definitely recommend you check out her Instagram because it's like loads of information. You're going to learn so much. I'm learning so much because I love really collaborating and talking to other practitioners because you can always learn something new. That's what I find. You just can always learn something because everybody has a different perspective.
Yeah, that's so true. And I'm an avid regular listener to your podcast, and I could say the same. I always learn so much from you and all the people that you interview. So thank you for doing what you do.
Oh, that's awesome. Well, I admire you. So that's really nice to hear that coming from you. So thank you so much, Allison, for coming on today.
Thanks, Michelle.
So that concludes today's episode. You can find all of the links mentioned on the episode notes. If you're enjoying these episodes, please take a moment to share and leave a review. Reviews mean everything to podcasters, and I really enjoy hearing from my listeners. You can also find me on my website at www.thewholesomelotus.com or email me at info@thewholesomelotus.com. I love hearing from my listeners. If you're interested and want updates as well as a free ebook on my top 10 fertility boosting habits, you can visit my fertility page on www.thewholesomelotus.com. I thank you so much for listening in and hope that you have a beautiful day.